My name is Brooke Pittman. I am in my senior year at UAMS, Respiratory Care, and it has been a very exciting and challenging adventure so far. We started out with a lot of classroom activities and hands-on laboratory experiences, and then we moved more into the clinical realm of things, and it's really neat how it all relates together. We learn something in lab, we test over it, then we get to go to clinical and see it firsthand, and everything is integrated together. You can see what you're walking into. So the first time I was in the hospital, I felt pretty comfortable, way more than I thought I would because of this program. It's very rewarding, and I've learned a whole lot, and I feel confident and proficient in my abilities and feel like I can be a great therapist because of UAMS.
When I talk to some of the young kids today that are thinking about respiratory care, I always like to tell them about the variety. So UAMS, they are going to prepare you to step into a critical care role. So they're going to prepare you to be a critical care therapist. But we have therapists that work with neonates and teeny tiny infants. We have therapists that work with patients with cardiovascular issues. We have therapists that every time the helicopter takes off here, there's always a therapist on board. So that's a great opportunity in and of itself. But you have therapists that work in clinic situations. Some will work in pulmonary function studies. Sleep disorders, that is a big field for respiratory therapists. So there are a lot of great opportunities for respiratory therapists.
I really like the intensity of some of the moments that I've had so far. As far as being in the ICU, you walk in and it seems like it's going to be a normal day, and you turn around and there's codes happening and there's people being admitted, and you have to think quick and be on your feet and ready to move and take action. And I really enjoy that kind of high-paced kind of setting.
And you have to be able to visualize things and put things together, because sometimes you don't have everything you need. So you have to improvise, and you have to be a person that can deliver under a high-stress situation and thrive on a challenge, because it's always going to be something new.
Very exciting career. I feel that the therapist is very respected on the healthcare team. If you have a good rapport with the doctors, and once you've been there and had experience, I feel that the doctors listen to the therapist and take their advice, especially on things such as mechanical ventilator settings, and should we switch the patient to this setting or should we try this. They are also a huge help to the nurses. I feel like the nurse and therapist can work together as a team to better the patient's care.
This is a field that you are dependent on. People depend on you to be there. And they need someone committed to doing their best in whatever it is that they're doing, whether it's therapy, whether it's educating family, whether it's educating a patient. If you're a hands-on kind of person or a very personal person and you need that human interaction, this is a great field for you.
You've got to have compassion. You really have to want to help people. Don't get into the profession because you think you want to try to make a certain amount of money. I mean, respiratory therapists do fine, but make sure that you're getting in because you really want to make a difference. You really want to be able to walk up to the bedside and make a difference. For me at Arkansas Children's, I can go into a patient's room, the kid's looking at me, mom and dad are looking at me, and very often I can go in, and because of what I know, and because of what I do at Arkansas Children's Hospital, I can leave that room feeling like I've really made a difference. Respiratory care can be very difficult sometimes because we're at the bedside at the best of times, and we're also at the bedside at the worst of times. So without compassion, I think you'd really be challenged.
Some of my most challenging situations have been with kids. It's hard to see kids not do well, and you see that in this field, and you have to be a strong person and know that you're doing everything you can to help these kids, and at the end of the day, just know that you've done your best, because there are some days that are really hard, and I've cried and been really upset about situations that have happened, but at the end of the day, I know that I did everything I could to help save that child's life.
Some of my most memorable patients and experiences in respiratory care actually happened at St. Vincent's. While at St. Vincent's, I worked in the neonatal intensive care unit quite a bit, and there we were able to go on the high-risk deliveries, and any twin delivery or C-section was considered high risk. And we delivered these two premature twins. They had an artificial airway, they were intubated, and were mechanically ventilated for a long time because their lungs are so immature. So watching them go from that point to 2 or 3 months later, getting ready to go home, they had gotten all fat, and they would play with each other. We would put them in the same bed, and they would actually play with each other. So to see them go from barely able to live, and to the point that I'm going home, I'm happy, I know that this is my sister, being able to hold them and pick them up, and they were going home and going to lead a normal life, that's very rewarding to see.
Seeing patients come in and being extremely ill and us helping them to recover and get better is such a rewarding experience.
I can tell you this, what motivates me today is pride. I am very proud to be a respiratory therapist. From that first day when I did my professional observation and I saw that RT at the bedside of a critically ill patient, it's pride in what I do. It's pride knowing that if a patient does get sick, one of the first people they call is the respiratory therapist, and that makes me proud.